Hi everyone, this is Leanne and this is From the Heart. Um, I decided to dive into the world of drinking alcohol in pregnancy because it seems to be a question and something that's kind of recurrent, and we're entering the world of holidays. So it's actually fascinating what I found. I learned stuff because it's changed recently. The amount of research or the things that research have shown recently are not what we thought just a few years ago. So that was fascinating. And also the other thing that it shows is that the more we learn, the less we know. And so that's just a good sign of good science. But it does add a lot of confusion for women, of course, and their care providers on what to say. And there is very conflicting messages out there because one study will show something and then another study will show something else. And yeah, it's confusing out there. So you're not alone when you are trying to decide what to do. So basically, what is defined usually in research is that a low moderate of alcohol is considered 1 to 2 drinks a week. A moderate amount of alcohol would be 7 drinks a week, but that would be 1 drink a day. And then binge drinking would be 4 drinks in a period of 2 hours or more. So that's like the common definition. And it does not include the occasional drinking in there, which is when you receive questions as a healthcare professional, it's more on that, the occasional drinking. Can I have a glass of wine when I go to my birthday party or something like that? And it doesn't seem like there is research on that. So that's like the definition of that. The alcohol, so drinking in pregnancy has been associated with what everyone knows as fetal alcohol spectrum disorder. People think that it is like a lot of facial abnormalities in a baby, but it actually is brain injury. So alcohol is a toxin, it goes through the placenta, and it can affect babies. And then most babies are actually not diagnosed at birth. They are diagnosed when they are in school and when they are teenagers, when we see things like behavioral disorders or learning disabilities, emotional regulation, things. So it's a diagnosis later in life. It's potential that it's underdiagnosed as well. Yeah. So the other thing that makes it all confusing is that out of women who binge drink, we say that 10% of those babies will have FASD. So it's not everyone who drinks that will have a baby that has that disorder. So it gets confusing. And then there are moms who will drink a moderate amount or a low amount, and then they'll have a baby with FAS. The other thing that makes it confusing is that years ago, so when I was practicing, we would say to one another as healthcare providers that a lot of women will lie about their drinking in pregnancy, even after their baby is diagnosed with the FASD. And so, but then what the researchers did, which is a great idea, was to see does the paternal, so like the father or the sperm producer, does that if that person is drinking, does it affect FASD? Because there's a lot of women who report not drinking and having a baby with that. So that it was a study on mice, which because and that the reason I know that a lot of people are like, well, it's a study on mice, it's not relevant to us, but it is actually, it's very unethical for us to do that sort of study on humans, and they are mammals, and then if it impacts mice, it will somehow impact us as well. So what they noticed is they had like three groups. They had a group where only the mothers were drinking, where only the fathers were drinking, and then where both were drinking. And they did see that paternal drinking did have an effect on the frequency and the severity of FASD. So yes, the paternal drinking habits do affect the baby, the offspring. So that's new information and interesting. And so this is going to add to the recommendations of like preconceptual recommendations that we do for clients, people who are planning on getting pregnant, and people who are having like unsafe sex, like sex that can lead to pregnancy. There is another study that showed, and this was really interesting, it was a group of 80-some twins, so like mothers that had twins, and out of the twin duos that were identical genetically, and then out of the twin duos that were not identical, the ones that were not identical, and the moms that were drinking, showed that one baby can be affected differently than the other baby. And then when you look at the identical duos, a baby that's affected by the alcohol drinking will be the exact same for the other one. So the baby's genes determine a lot on how they're going to be affected by the maternal drinking. So that was also fascinating and not that new, but I didn't know that until at some point in my work, but not when I was a student. So those are things to consider. And then when you look at all of that, you're like, well, what should the recommendations be? And so, of course, recommendations are kind of a black and white. They're trying to fit everyone in based on what we know and what we don't know. And so it's true, like, even though there are some studies, like the Danish one that came out in 2012 showed that if women were to drink low or moderate amounts, that they didn't see differences in the babies, and so in the children at 5 years of age. But when you consider that we diagnose babies with fetal alcohol syndrome or spectrum disorder, and we usually do see that later in life, that study may not have been long enough for us to be able to properly see and diagnose what differences there could be between the babies that had a low or moderate amount of alcohol when they were fetuses versus ones that did not have alcohol. So anyways, that study did cause confusion, because if you really think about it, 5 years does sound good long-term wise, but I would say that it's not. So yes, the recommendations, when you talk to researchers, would say that we should not be drinking alcohol at all in pregnancy. And that's just based on the information that we have. So so that's what we've got today, or what I was able to gather. Also, alcohol can affect pregnancies in different ways as well. It can add risks for preterm births. It can add there's babies that are born small, not just their brains being small. That would be considered one of the signs with fetal alcohol spectrum disorder. And some other ones, I think preeclampsia as well, and things like that. So it's not limited to just brain injury in the baby. Then I was looking at breastfeeding, and what I found wasn't necessarily studies, it was just more experts on what they say on breastfeeding alcohol. And it's true that after a baby is born, if a woman really wants to have a glass of wine with like after her first meal or something like that, like it's totally fine. I've been at births like at Christmas and births on, birthdays, or just because they just wanted like a champagne to celebrate like the day. And there is no recommendation that tells a woman to not drink while she's breastfeeding. There is this idea that women should pump and dump. However, this is outdated. What actually decreases the amount of alcohol in a woman's breast milk is time. It's not pumping. So if you were to pump and then feed your baby, after that, it's like the alcohol level of in your blood that determines what your baby gets at the time. So if you need to pump, it should be because you need to empty your breast, and not because you need to pump and dump because there's alcohol in your milk. So I hope that makes sense. It also seems that the big concern about drinking while you're breastfeeding is more how can you take care of a child when you're inebriated. So when it comes to recommendations and what healthcare providers are looking for are when parents or the people who are taking care of a child are drinking, whether they are infants or you're breastfeeding or not. If the child is older, is that there should always be someone who is responsible for the child and is not using any drug that can impair your judgment, basically. So no alcohol, no weed, etc. And there should be an adult there that is capable of responding to the child's needs, basically. So we say that the biggest concern is how that if you're binge drinking, how are you able to respond to your child's needs? So that's like a summary of everything that I've put together, and I hope it's useful. I am not here to be judgmental around usage. I'm here to just provide information and show you how complex it is to make these decisions and these recommendations. And the other thing, another layer that makes it difficult is that because there's a recommendation of not drinking at all, that women who are alcoholics, who have an addiction, like that recommendation may not apply because they may not be able to quit alcohol drinking. So it's important for both the healthcare professional to ask questions in an open-ended way, which we may not, because we might just assume that a lot of women just know not to drink. And then like a tool that I used later in my career was, what is it called? Motivational interviewing. And that was really helpful in getting information out of clients in a way that doesn't feel judgmental to them, and then explaining to them what their options are afterwards as well. So I think it's important to have a knowledge on that and how to do that. And then the other thing, it's important for mothers and fathers to know that if they have a disorder, like an addiction, it's important to get help so that you know what your options are and how to decrease the amount of alcohol. that you're intaking. So um, yeah, there's no answer, but basically my suggestion is just that you do your best and that you have really good discussions with your care providers. The other thing that could add to research and data that we have is just that you tell your care provider what you are doing and what you're choosing to do, so that we can actually look better at outcomes, if we capture them at all. And in Ontario, I believe that we do. I'm just not yet. So um, anyhow, we need to start doing more of that. Um, I think that's all I had to say on alcohol. I hope you have a splendid rest of your day. Thank you for listening. There'll be some resources in the show notes if you want to look more at the studies. Um, yeah, see ya.